Welcome to today's Global Connections program. I'm Bill Miller. Today we're going to take a look at what we can do to have better health and well-being. My guest is an expert in this area. Mr. Chuck Stetson is the CEO of the Stetson Family Office of the Coalition for Better Health at a Lower Cost, of which one of his goals is to advance the United Nations 2030 agenda, especially the goal to promote good health and well-being for all. Mr. Chuck Stetson, welcome to today's Global Connections program.
Well, thank you for having me, Bill.
I appreciate you being with me today. Let's just jump right into it. And you said to call you Chuck, so we'll do that. What is the Coalition for Better Health at Lower Cost? Well,
I'm the beneficiary of having gone to the Cooper Clinic for actually 23 years, but there are 20,000 of us that have gone there 20 years. So 20,000 people is a lot of people. 20 years is a long time. Our healthcare costs today are 40% less. Our incidence of Alzheimer's is 36% less. I think it's very interesting in today's world when we have presidential elections coming up here in the U.S. next year, and the Wall Street Journal, in 2 articles in June, said healthcare costs are going to be the #1 issue. We even know from the midterm elections that 75% of the people came out because of the cost of healthcare. And we're sitting on the solution. That's why we're putting the coalition together.
Very good. 2 questions. One, where is the Cooper Clinic located? And secondly, how are the costs coming down? You mentioned a dramatic reduction.
Right. The Cooper Clinic is located in Dallas, Texas. It was founded by Ken Cooper, who worked with astronauts once he got out of the medical school and was preparing the astronauts for their flight to the moon in the mid-60s, and he invented the word aerobics. He put it on in 1966, he put it on a book in 1968, sold 30 million copies of it, and we had 100,000 people at that time jogging. My father got me jogging, so my father and I were 2 of the 100,000. But by 1984, with a shout out to Jane Fonda because she got some of the women going, there were 34 million joggers. And then it was 1986 that the Oxford English Dictionary decided to put it in the dictionary, the word aerobics.
They finally got around to it.
They finally got around to it.
It finally got in there.
But aerobics is really physical exercise, and it's different from anaerobics. Aerobics is 150 heartbeats or more a minute. And I'm not a medical doctor, but the medical doctors tell me what it does is that when you get your heartbeat up that high, it cleanses out the system and it takes it to the lungs where you exhale garbage that is collecting in your system. And so if you're sedentary, you're not getting it. If you're less than 150 heartbeats a minute, you're anaerobic, so you're not at the aerobic standard. So physical exercise does that. Physical exercise, they've now found out, creates neurons in the brain. And they can see for someone that's exercising, the brain actually lights up. And all. And so if you're sitting, it's not doing that. And it's amazing because if you do the exercise, it also reduces depression, it reduces anxiety, you do more socialization because of it. It's got all the right things, except we don't do it. Although coming over here today, I could have taken a taxi, I could have taken mass transit. I walked.
That's the way to do it. It is a win-win situation. There's no doubt about it. And our viewers can go to your website at coalitionforbetterhealth.org to get more information. Let's talk a little bit about the coalition. Who are some of your partners?
Well, we started out by looking at the Sustainable Development Goals,
United Nations.
And I have a pin.
Yes, you do,
for that.
Right there. Yes.
But we focused on #3, which is basically living healthy at all ages. And I would emphasize at all ages, which is really important because we need to. We can't let our guard down. We have to be on our game all of life. And if we do, we have these chronic diseases. There are 5 chronic diseases. Alzheimer's, cancer, diabetes, obesity, and heart disease. They're really a phenomenon of the last 100 years because we have very unhealthy lifestyles. When this country was had mostly farmers, they all exercised, you know, and even the people in the cities, they exercise more. But now that we have all these modern conveniences, we don't exercise, and the computer has a lot of beneficial things that it does. One of the things that's not beneficial is it gets us to sit still for far too long, and then at places like call centers, they feed you pizzas and all that. It's the worst thing in the world for you. You've got to get up and you've got to move around, and that's the way we were designed. And when we don't do it, that's when we get these 5 chronic diseases that creep up on us.
And so often we've heard, and I assume this is true, that you need to exercise, which you've been talking about, also have a good diet, and to do preliminary screenings, preventive medicine,
right,
so to speak. Is that really the triple hit right there,
well,
for a better,
yeah,
better quality of life?
I'm going to call it 5 by 5. People
5 by 5.
People can. I gave you 5 chronic diseases.
Right.
They're what the medical professions call comorbidities. You can address them 5 ways. We've talked about physical exercise. You mentioned eating healthy, and that means vegetables and all. I eat lots of soups. I have lots of soups, and I have lots of salads. I do not eat red meat. I do not eat fish for other reasons because of the pollution. But I stay on target. I make a few exceptions a month. Okay, that's allowed. But you want to keep your weight under control. You want to have no smoking. And you want to drink in moderation. So instead of 5 glasses of wine and a bottle, half a bottle or so in an evening, restrain yourself. It's 5 glasses of wine a week.
5 a week.
5 a
Okay.
week. We have to restrain ourselves. And if we can keep this simple format, it's not a total guarantee. And the World Health Organization, which is a UN entity, calls it risk reduction. There's a term preventive medicine, and you can't always prevent everything, but you can certainly reduce it, and in most cases you can prevent it.
How are we doing? You mentioned the United Nations Sustainable Development Goals. You've got what they call the SDG pin that you're wearing right now. There's 17 of these goals.
Right.
Goal to eliminate poverty, to eradicate hunger, to empower women, to combat climate change, to protect the oceans, below the surface of the oceans. Right. And of course, number 3 is what we're talking about here, better health,
right,
good health, and well-being. How are we doing in that particular area? We're almost 5 years, a third of the way through the cycle on the development agenda, the 2030 development agenda. How are we doing in that area? Have you seen any statistics on this? I know you're doing your share, no doubt about it, but yeah, are we moving forward in this area? Are there a lot of other folks who are involved in this? Not only in the United States, but
what
around
we're
the world?
finding is really not. There has not been progress, and that's why we jumped in. And what we're focusing on is really the 5 by 5. These are the 5 chronic diseases. These are the ways that we can risk reduce it or prevent it. And let me just walk you through Alzheimer's.
Sure.
We are in an epidemic, and I use the word epidemic very advisedly. We have partnered, for example, with the Alzheimer's Disease International that curates all of the Alzheimer numbers. What we know, and I'll give it the U.S. numbers because I happen to know them, the U.S. government is spending $288 billion a year on Alzheimer's. It's expected to double by the year 2030. That's 11 years from now. And it's expected to hit $1 trillion by the year 2050. Now that does not include caregivers. And the victim. So when someone comes down with Alzheimer's, they typically lose their job. It's usually their spouse that becomes a caregiver, and if they had a job, they lose their job. And it's all money going out. It's a really devastation to the families. And we don't have this under control, and we must get under control. And that's why we formed this coalition, and I'm delighted to be working with Global Partnerships Forum and Amir Desal, who it's really a public-private partnership. with the UN, and the Secretary General has been very keen on having civil society participate. And this is a perfect opportunity where we already have a number of the ambassadors that we've been talking to, the ambassador from Monaco, the ambassador from Finland, the ambassador from Egypt, Israel, Hungary, the Czech Republic, and Malta, and Botswana. And we're just going to build this thing out. But every country needs it, and we need it now. We need to get these chronic diseases under control.
As you have been looking at these 5 non-communicable diseases, I guess we could call them, the 5 major diseases, Alzheimer's in particular, the figures are staggering. I mean, they're soaring, and the costs are soaring right along with them. Do we have an idea of what causes Alzheimer's?
It's very interesting. The research, researchers don't have that answer, but we do know how to prevent it. 1/3 to 1/2 of Alzheimer's can be prevented. So they did a study, and one of our scientific advisors is Mia Kivipelto from the Karolinska Institute in Sweden. And she did the original study in Finland called the Fingers Study, and it was announced in 2015. But she's now working, in January it was with 15 countries, it's now up to 25 countries. And she met recently in Los Angeles with 19 of the 25 countries. She's looking at the issue of men and women. Turns out that men's brains and women's brains are different. Yes, we have always known that women are from Venus and men are from Mars, but their brains are constructed differently too. And women, for example, once you have Alzheimer onset, it comes in quicker, but we do know how to prevent it. And I gave you the 5 things that do, of which physical exercise is the most important. And the UN's World Health Organization just came out in May with the risk reduction guidelines for cognitive decline and dementia. So it's a kind of a mouthful. But number 1 is physical exercise. If you do the physical exercise, and what do we mean by physical exercise? Well, that means get your heartbeat up. I go out and I cycle, and I hit between 150, 155 heartbeats a minute for 31 minutes. I do it twice a week. I'm over 70, and I do it. But you know, if you're a little bit younger, you can even get your heartbeat up more. You can run. You know, when you get a little bit older, you want to probably watch your knees a little bit. So cycling is a little bit easier on the knees. But you want to get out, you want to do it, and you want to be disciplined about it. And by the way, you're going to have a better day when you do it, because the endorphins kick in, you're brighter, you're happier, you're nicer to be around. I mean, all the good things happen when you do the exercise. Why aren't we doing it in a more disciplined fashion? And so one of the things that separates this coalition out from other coalitions is accountability. In everything we do, we insist on accountability. And that's what people don't have. There's a lot of people out there talking about physical exercise, this or that, and everyone says, sure, I'll do that next week, and they don't do it. We're looking at putting in systems back into the schools. The schools used to have all this stuff, and the golden age for physical exercise in schools, curiously enough, was 1885 to 1920 in the United States. And then we had a kind of a renaissance when President Kennedy came out and said we need to do better physical exercise, we need to have stronger citizens and all that. So we had a little bit of a kick in the 60s, but we've kind of lost it, and we need to recover it. And we certainly can. We've done it before. We need to recapture that.
Yeah, we can do it again.
And we need to recapture it around the world. And what I'm delighted to say is that I travel around the globe. I go to Asia twice a year, and I go around to China, Australia, the Philippines, Singapore, India. I go to the Gulf states. I go to Europe. These are all places that are really coming around and being very interested in it, and I'm just thrilled. In fact, in some ways, with some of the universities we're working with, it's a lot easier to work with the universities outside the U.S. than inside the U.S.
That is a truism. Yes, we're going to come back and talk about that. Well, you're watching Global Connections Television, which is a privately funded, independently produced program. The opinions expressed on Global Connections are solely those of the moderator and his guest. We would invite our viewers to go to our website at www.global globalconnectionstelevision.com to view previous programs. Also, if you're involved with a PBS or community access television station, or perhaps an educational institution that has an intra-campus television hookup, or you just have a website, you have a computer, you like our shows, and you would like to share them, please feel free to do so. Global Connections Television is provided at no cost as a public service to help people all around the world better understand international issues and how they impact our lives. Today we're taking a look at how we can have healthier lives, and my guest is an expert in this area. Mr. Chuck Stetson is the CEO of the Stetson Family Office and the creator of a new initiative, Coalition for Better Health at Lower Cost. Chuck, we're talking about this. You're talking about universities. I don't want to leave that one out hanging for a moment. You're talking about working with universities. How have you done that, network with partners from overseas and within the United States as far as universities?
Well, I'll give you a couple of examples.
Okay, please.
We have a couple of universities that we're working with in places like the Gulf states and in China, where they all have costs. And they see their costs of health care for students and for faculty and employees soaring. So one of the things that we can do is, at least we start with the students and we do a pilot with the incoming students, and we've got a couple of these. We haven't done it yet, but we should have this implemented within the next couple of months. But we have a couple of universities ready to work with our program. And I told you early on about the Cooper Clinic. The Cooper Clinic, there are 20,000 of us, 20 years, 40% lower healthcare costs. Well, we did it really by observing those 5 things that I talked about: physical exercise, eating healthy, keeping your weight under control, and no smoking, and not drinking in moderation. In the Gulf states, you don't have the problem with the last one. But in any event, physical exercise is really the driver. And it keeps you, among other things, that we know that at least 20% of the kids around the world, also adults, have mental health issues. And they go to the mental health part of the university. And one of the things that the universities are very concerned about is suicide. And they take it very seriously. They don't have any numbers. So what we're doing is, with the universities, we can help them monitor people for physical exercise. We can also help them monitor brain health. And you want to have a healthy brain when you're in the university, so that you can do well. And really, the goal of a university should be to not only prepare people for life, but prepare people for a healthier life. And we can do that. And we are taking the protocols that they have at the Cooper Clinic. We've upgraded them with our world-class medical team, and that's what we're doing. And the goal with the university is very simple. People respond to economics. If we can lower the cost of healthcare, and we can do it with a fairly big number, and we have a whole system that we do this with, we can really drive healthcare costs down. And the nice part about working with kids in university is they're going to live like 50 or 60 years. If they just go after the people that are over 65, hey, we're gone in 30 years. But you can get the nice longevity by working with the college students. And you've got 4 years of college to form habits, because habits are what you have to come back to. And you got 3 years typically in graduate school. So if you can form the habits then, maybe you go off the wagon a little bit for a time when you get work and busy in work, but you have something to come back to. And that's what we want to make sure that we have kids coming back to. And we also want to do, and we're going to do this next year, we're focusing this year, it's a 3-year program at the Coalition for Better Health at Lower Cost at the UN. We're focusing on the 65 and older. Next year we're going to focus on schools and university, and the 3rd year we're going to focus on the workplace.
Wonderful. That's very good. Have you heard any of the professionals say that children or babies who are born today, if they live a healthy lifestyle, if they do the 5 approaches that you were talking about, that they could easily reach 100 or beyond that? Have you heard any of that before? Or is that just
no?
Something
I'm going to answer it this way. There are blue zones. You can Google it if you're not familiar with blue zones, but we have one blue zone in the United States. It's Loma Linda, where people, these are where people live to 100. And my mother is going to be 99 in 2 weeks, and she has been just amazing. You know, she's gone a couple of times to the hospital. It's usually because she didn't drink enough water and her electrolytes weren't enough and she fainted or something like that. But, you know, she wasn't there for any major, she didn't run up any major expense. What we have right now is about half of our medical costs that we have in our lifetime is in the last 6 months. That's ridiculous. If we got on a program, we can do what we call, what they call in the medical world, squaring the curve. You live longer and you die in your sleep. You know, why pay out?
Perfect way to go.
Right. Why spend all this money on health care? I mean, you don't need to. This is a self-imposed problem that we have to unself-impose ourselves with.
You're quite right. That is exactly the way it should go. Well, you're really doing some remarkable work. It's fantastic what you're involved in, and hopefully more people around the world will get involved in it as you move forward. But as you look at what you've done in the past, what you're planning to do in the future, what do you see as a couple of your major challenges? Are we talking about education? Are we talking about advocacy? Are we talking about training? What are some of the challenges that you're going to be, you and the coalition will be dealing with as you move forward on this project?
Well, it's always, early on, it's building the coalition. I've built coalitions before. I know how to do it. I also know how to change people's thinking. And we have an education foundation, which is an educational publisher. And in 2005, we launched that. And 2 years later, we had every major newspaper in the United States endorsing us. We had the New York Times with a half page with a picture endorsing us. We had the cover of Time magazine. I've done the Today Show. I've done CBS Sunday Morning. But the technology has changed. You know, that technique that I used at that time is not really available anymore. And so social media and all of that kind of stuff has changed. And so one of the things that we're working with today is the fastest growing talk show in the United States, Our American Stories with Lee Habib. It was 88 last year. It's been 38 this year. They expect to hit the top 10 next year. And we're looking at getting the reach. And the radio is a good way to get reach because two reasons. First off, everyone has to drive to work or come back from work in most cases. And so you've got them sitting in the car. And for the older crowd, they will listen to the radio. For the younger crowd, they tend to listen to podcasts. And we've got both. And we are the health group that we sponsor the health section of Our American Stories with Lee Habib. And a number of the podcasts on www.globalbetterhealth.org, his team put together. I give them the names, and they go out with the radio people, do the interviews, and put the story together. 65% of people remember stories. 5% of people remember facts. So stories is the way to go, and that's part of the mechanism that's changing. And the podcasts are a relatively new thing. You're doing podcasts, and we're in a different world. We have to deal with the world the way it is.
We certainly do. In the last 30 seconds we have, I apologize for that. What is the most memorable event that you've experienced in this work?
The most memorable work is really coming to the understanding that that we can get this under control. I was with Ken Cooper getting my exam. It was 2 years ago, and he whispers in my ear, you know, did you know that there are 20,000 of you that have been here, coming here 20 years, and your healthcare costs 40%? He speaks very fast, so I said, did I hear that right? would you repeat
Run that number by me again.
Yeah. And then I said, okay, I heard you say it. Send me the backup. And he sent me the backup. I said, my God, we can do this. And that's why we formed the coalition.
That is great. It's so commendable that you're doing this. It's so important, and we would encourage everyone to get on board and do the same thing that you've been talking about, and to learn more about not just Sustainable Development Goal number 3 for better health and well-being, but also the other 16 Sustainable Development Goals, because they are so critical, and they're certainly going to help us to create a better world. But Chuck Stetson, I want to commend you again for everything you're doing, and I want to thank you so very much for a very interesting and a very informative program.
Thank you.
Thank you. My pleasure. I'm Bill Miller. Thank you for joining us today on Global Connections Television.